As anybody who's had viral conjunctivitis, known more commonly as pink eye, can attest, it's contagious.
It passed on really quick, like within a week the whole house had it.
Even so, Diego Bellissimo and his family weren't overly concerned, so they asked their pharmacist, who told them pink eye. But a little over a week after starting antibiotics, Diego's dad's eyes were still dark red, and the 18-year-old looked like he'd been in a fight.
Because it got infected as well, it looked like I was Rocky. I couldn't open my eyes for basically 5 days.
Concern turned to worry, and after a visit to the optometrist, they were stunned to learn the goop in their eyes came back positive for COVID.
So these are all cases that we had in one day. Look right over here.
Dr. Ken Mandadakis says at its peak he was getting 4 to 5 cases a day and is now seeing a spike in new cases. The strain is viral like traditional pink eye, but it's more aggressive than anything he's ever seen.
Unlike the other viruses that we've seen in the past, this one is causing a lot of inflammation of the eye, a lot of swelling of the tissue of the eye, blurred vision, pain, and it's causing bleeding in the white of the eye. So instead of it being a pink eye in appearance, it's actually a red eye, like a hemorrhaging type of appearance.
When asked, the Ontario Optometrists Association says it's certainly aware of an increase in serious viral eye infections, and they did post some information on their website earlier in the season. However, unless they do a broader social media campaign, information on this issue is spreading word of mouth. So optometrists telling pharmacists what to look for.
This is a patient who is obviously more advanced. We see a lot more hemorrhaging and redness of the eyes.
The treatment for these aggressive cases includes an eye wash, followed by prednisone drops, and symptoms can last for months.
Some patients were left with spots in their cornea that would then lead to glare and halos around lights that we now are treating for a longer term, like so let's say 2 to 3 months.
Diego Bellissimo is getting better, but some of the side effects haven't gone away. He says he's learned a valuable lesson. When it comes to his eyes, he's seeing his optometrist. Mike Drolet, Global News, Toronto.